But for now, let's take a look at what the president had to say yesterday.
To partially reopen will only bear fruit if we recognize that this exercise is a shared responsibility. It is my intention that not only shall we reopen as we have done now, but we shall go further in our partial reopening as we go forward. However, I must also be clear that that shall be based on the behavior of each and every one of us individually. So therefore, fellow Kenyans, to reopen and to remain open, you must become your brother's keeper. You must become your sister's keeper. While the government will no doubt do its part to achieve this desired wish of remaining open, you, my fellow citizens, must also do what is expected of you personally in order for us to achieve it. This, therefore, is not just a call to reopen our country, but it is also a national call to civic responsibility. And on this, I must further add that civic responsibility is not a demand placed on self or on the individual by the state. It is not a demand that the state can enforce. It is therefore a duty that you individually owe your fellow countrymen for coexisting with them.
Right, and to take a deeper look into the possibilities and whether we are prepared to take this responsibility into our very own hands is Michael Agwanda, a man of many hats. He is sitting in today as a public health expert. Later on, we shall be joined by Peterson Wachira, who's the chairman of the Kenya Union of Clinical Officers. Welcome to the show, Michael.
Thank you very much.
Now, let's start from that element of personal responsibility. You've witnessed it. We've called for this easing of restrictions. We wanted to travel and do business and get the economy going. We've gotten what we wanted. But when it comes to masks and keeping a distance and, just being responsible at a personal level, do you think we are ready at that capacity to hold this ourselves?
First, I have to thank the President for opening the country. As I've mentioned before, it was totally inevitable. It had to be open. It was just a matter of time. It was a matter of when, but not if. Secondly, I also agree with the President that it's a matter of personal responsibility. One is because COVID-19, it's real. Coronavirus is with us. And it causes death for that reason. And therefore, if we know that something is around us that causes death, we need to be careful about it. We need to follow what our Ministry of Health is telling us to do. We must have the mask. We must ensure that we keep our social distance, or people actually say keep physical distance, because social distancing doesn't seem to make a lot of sense here. So let's keep physical distance and let's avoid a crowded area. And we also need to know that if we are coughing or sneezing, we need to keep away from other people, so that even if we had the slimmest chance of infecting another person, we need to avoid it. I think it is our responsibility. However, I want to say this. This is not the time to continue stigmatizing the people that are going to the village. I really don't think it is right. If somebody went to the village today and then you called the chief and said, hey, this is what we've been doing for the last 4 months. You're from Nairobi or from Mombasa, and therefore we're going to call the chief on you. I don't think that is right.
Now, Mr. Agwanda, There is an element of fear that is associated with coronavirus, understandably so, if you see what it does to people and obviously the risk of death. And rural areas are where most of the elderly folk in our population are located. So that fear to some is quite justified. So when it comes to traveling up country, wouldn't you say it's fair to expect those who do not have to travel, as was said yesterday, not to travel, just to be responsible and protect those people who are up country?
Again, you cannot stop people from traveling to the village. I say this with great authority, knowing very, very well that there are over 1 million plus people that have lost their jobs. They can't pay their rent.
Right.
They live in the cities and they have to go home, sometimes just to go to that little shack, grass thatch house and recollect themselves and see what the future holds for them.
Yes.
We've been seeing a lot of clips of people that have been kicked out of night and out of their houses because they've not paid rent for 3 months. They've lost their jobs. They're not sure whether they will be able to get their jobs back in the next 3 months or so as the economy starts recovering. And therefore, it is inevitable that these people are going to go back home. My fear is if the practice has been that if you went home, then people will call the chief on you. They need to know that the president has opened the country and therefore people are allowed to move freely, however, with great caution. And that should be known to the entire. Remember, this is the only country whereby if you have a curfew, people will die because they'll be clobbered by the policemen.
Right.
People really do not know how, sometimes don't understand the kind of instructions or the political statements that are being made. They take sometimes matters in their own hand and make their own conclusion on it, and that can put some people's life in danger. If people have to go home, I mean, they have no choice. They'll have to go home. But I think it is clear that we need to take all manner of precaution. Another thing that I want to say, that it is also high time the government of Kenya realizes that health is about primary health. And not necessarily secondary health, not necessarily treatment. What we've been seeing is a lot of investment, taking place in the hospitals, a lot of investment taking place in the doctors and nurses. But remember that community health workers, the people that are living with the community together, these are the primary health people. And mostly primary health deals with preventative, not curative. And that is a problem we are having in this country. That preventative, we are very low. In fact, public health aspect of it is not even recognized that much in this country, and community health, which should be our primary focus so that people living in the community knows that to protect yourself against any disease, not just coronavirus or HIV/AIDS, these are the things you need to do. But I'm seeing that a lot of investment are taking place on curative, a lot of investment now are going into research on vaccine, a lot of investment are going on PPEs. Let's go down to the ground and start telling people that once the country is open, it is inevitable that indeed the coronavirus is going to spread like wildfire. And we cannot stop this. We cannot stop emphasizing that if we don't take precaution, everybody's going to catch it. Perhaps this could be the reason why maybe the president decided, after all, we have to open the country so that we can hit and see the possibility of hitting herd immunity and see how the country copes up with this.
Yeah, now let me take you back to the element of traveling, cross-country travel. Now, in countries such as China, when they had people moving within, in between states, or they are called provinces, would have them being required to self-isolate for a period of time before going on to interact with the localities. Even if you moved 1 meter across the border and came back, you would be required to isolate yourself and see if you are safe, so as not to bring the virus from one province to the other. Don't you think that would have been a bit of a measure to be put in place in order to ensure that we are not doing this traveling and spreading the virus? Wouldn't that be
that is only possible, especially in a place, in a country where you can go to your nearest health center, get tested of COVID-19 and be found to be positive or negative.
Yes.
As it is today, if you're in Kakamega, perhaps the test will have to be taken all the way to Kisumu CDC. If you're in Nairobi, there are only few centers that will be able to test COVID-19. And for that reason, it is not practical for Kenyan situation.
Yes.
And therefore, if you want to isolate yourself, that's okay, you can do that. But again, how do you ensure that isolating yourself will minimize you from the fact that you could have been been sick earlier or not, and how would you know that?
And then it would minimize you from spreading it.
From spreading it, and how would you know that if you're not able to go across the street and test yourself? So that is not practical with Kenya for now. And we also know that, you know, the Kenyan government have actually come out very clearly and said they do not have enough reagents to test COVID-19. And so that is why you're finding Lancet having a number of people going there. We have Nairobi Hospital, National Influenza Lab, people going there, because there are only few places, and they do not have enough reagent. And it's not just a problem with Kenya, it is a global problem, because everybody is looking for this reagent. Everybody is looking for PPE kits. Everybody is looking for masks, because this is a global pandemic. That's why it's a little bit critical, and it's a little bit complicated. I wish that as we move forward into the season of opening the country, which must be done, in my view, and I thank God that that happened, that people will take precaution, but again, that employers will be able to, you know, businesses will be able to come back, you know, into place, that they will be able to open, because if they don't open for some times, it's going to be difficult for people to get their jobs back again and their families back again. You know, the president mentioned something that caught me with great concern, and that is domestic violence. I was just imagining how a situation would be in a house for 3 months. You have no job, your house has been locked up, and you have a family and children that need food. Let me tell you, it is a very complicated matter, and that comes as a result of frustration of having nothing and being unable to take care of a family. I hope that the businesses will open up, that the people who are employed will be able to be allowed to go back to work, and that business will not open up. And then they will hire new people pretty quick, forgetting that the people that have toiled with them and labored with them for years and generations are out there and have no jobs, and were hoping to get jobs only to become jobless.
Okay, Mr. Gwanda, let's get back to the hospital level of things. We are hoping that all these hospitals, both in Mashinani and at in Nairobi, are having that bed capacity that is needed, because the very unfortunate thing that would happen is having COVID-19 patients not being able to be isolated in isolation wards. But then far from that, you have spoken of the other elements that are required. It's not just a bed that is needed when you're treating COVID-19 patients. There's the treatments, the medicines, the PPE equipment, and we are hoping that our hospitals are ready, particularly up country, but we do know that this has not happened as far as county governments are concerned in implementing that. Talk to us about that and what that could mean if a possible spike occurs.
If you don't have enough personnel and medical personnel, and you do not have enough medical equipment, we are not cheating yourself. We are in great danger. Let me give you 2 examples. You have Kirinyaga County, where Governor Uhuru fired a lot of doctors, and they've not been employed, I think, in 2 years, re-employed in 2 years. And we know that during the Senate interview just more recently here, the doctors were confessing that people were coming from Kirinyaga to go to the neighboring counties to get health treatment. And we know that, for example, Kisumu now, the doctors are on strike. You cannot possibly say you're ready if you do not have enough ICU beds and you do not have enough doctors to treat these people. You cannot depend on clinicians and nurses only, citing those 2 counties. And there are many counties, including Siaya, where, I don't know whether they've reported increase of bed capacity in terms of ICU, but last, I think they only had about 9 or so. So you're looking at this, and the reality is there's a lot of call out there for health to be reverted back to national government. Something I say no. I think the governors need to take this matter very seriously, because I know and I have friends that are working in Kenyatta National Hospital, some working in Aga Khan, and they're saying that actually ICU beds are getting filled up with COVID-19 patients.
Yes.
And for that reason, it's just a matter of time before it goes into the other counties. The question is, are they ready? And if they're not ready, why is it taking them too long to be ready? I mean, I know, again, when you're buying equipments for the ICU. It's not just the oxygen you're looking for. It's a lot of other things. And the training of nurses that are actually called ICU nurse, that really will be familiar with the ICU machines, will be familiar with the breathing of the patient, and will know whether it is critical or not. We are not ready as counties, I can tell you, to handle this. Other than few counties that are being cited to be doing very well, just like Coast, Mombasa County, and maybe the neighboring counties here, but we are having a problem with our counties that are just so slow to implementing this, and perhaps they've been looking at numbers and thinking that, oh, we are really safe. I mean, if you look at Homa Bay, the numbers are very little, and so if that is the reason why they're saying, well, we don't know whether we need to invest in this, you're cheating yourself. You need to invest in ICUs, and you need to invest in the capacity, human capacity, human training. You need to invest in those doctors and pay them well so that they don't look for a job when you need them most, like what you're doing in Kisumu.
Mr. Gwanda, is it a question of not taking it seriously or not just having the funds to implement this? Could you paint us a picture of the funding for the health sector at the county level, and why we're having hospitals turning patients away because they are literally unable to treat them for COVID-19, or at least handle them at the very basic level? Why would this be transpiring?
It is not a matter of funds. It is a matter of laxity. It is a matter of corruptions in the county. It is a matter of theft, because 5 billion has just been released from central government to go specifically to address issue of COVID-19. I know a lot of counties have received over 100 million Kenyan shillings to at least equip about 30 or so, emergency, ICU beds. The question is, why is it taking them too long, yet they've had the money? And again, we're not talking about just this money that has been given. We know many counties have had fundraising, and people have given money for COVID-19, specifically for, to enhance and speed up the preparation of any eventuality that the numbers might soar up like they are soaring up now. And so I really think that the counties need to take this very seriously and not also get into the bureaucratic nature of procurement businesses that is all induced and all, corrupted to a point where you want to get money even when people are dying. And I think that is what has been happening in most counties, where corruption is just part of the operation there. Any money they see, like this huge lump sum, specifically for COVID, people are already lining themselves up to line their pocket, which is quite unfortunate. If I hope the DCI will be able to turn and rein on these people and really follow up whether this money that has been given, the 5 billion that has been given, is being used the way it's supposed to be. If not, we will just hear stories. People will supply things that are outdated. People will supply things that, will rent machines, and then after, the fiasco of COVID-19 is over, they'll take the machines. We've seen all this happening in the counties. I hope that DCI and EACC will rein in the operationalization of COVID-19 in this country, because people are already stealing this money, which is unfortunate.
And as I told you earlier on, the chairman of the Kenya Union of Clinical Officers is joining us. Peterson Wachira is coming to us live via Zoom. Mr. Wachira, could you paint us a picture of the role of a clinician in the whole string of taking care of a patient, how they would come in contact to that, and how perhaps our health systems are prepared or not to handle a possible spike in infections owing to the more relaxed measures that have been put in place right now? We are now able to traverse our counties and travel and go around our business. What would the danger be, and how does a clinician come into contact with possible infected patients and treat them?
Okay, thanks a lot, and thanks for having me. A clinician in this country, that's a clinic officer, is found in all levels of healthcare, from the dispensary down there to the level 6 hospitals. Also, when it comes to the isolation facilities and the quarantine facilities, we are also managing them across the board. So what you realize that is happening is that a bigger chunk of the health practitioners who have actually been infected are from the lower facilities that may be considered as low risk. And this is where actually the bulk of my members who are clinical officers are. And this is the first point of entry for these patients where they come in to seek this service, and then you can be able to diagnose according to the case definition and say that actually this person is a suspect for COVID-19.
Right.
And then you can be able to diagnose and forward them. Now, what happens is the priority to give the personal protective gears, and even when it comes to other issues like to sensitization, goes there last because it's considered as a low risk. And that is why you have actually seen a good number of them getting infected down there. So with now the surge that is coming in, I think one thing that we know for sure is that the infection will go up. And it will not only go up, but it will go into counties, and these people will start now reporting to the nearest health centers down there. And of course, that is where also my members are, and my members are of course going to be at risk of this. And especially considering we have already lost some medics from COVID-19. So it's an issue that we are taking very seriously, especially to ensure that our members can be able to get the protective gears that they need. And of course that we have a compensatory mechanism that is not there for anybody who actually suffers from COVID-19 and may actually even die from COVID-19.
Now, when you look at you talked about your clinicians and they being at the very lower level whereby they come into contact, they're the first level of contact with the patients who could be positively or rather possibly positive of COVID-19. When we talk about this, we talk about ventilators, oxygen, and ICU beds. But at that level, that's not the language we are speaking. It's quite basic. Tell us how you would have a clinic fitted or, customized to ensure that it is safe for both clinicians at that level. What are the literal things that a clinic would need to ensure that the clinicians are prepared?
Actually, down there, what you need is actually just to have enough personal protective gears, and of course to have training as to how to be able to utilize them.
Okay,
and
so there has not been any training done?
Yes.
Has there no training been done?
The training we are now doing about 20% out of 100%. So we are actually doing very bad when it comes to training because the funds have actually not been available. And the training is not only on protective gears, even the other issues of how are you supposed to handle these patients in matters of triage? Do you triage everybody together?
Yes.
There are so many things in drawing down the guidelines, and even all the way up, because I even have the colleagues in like a KU hospital who are actually managing these isolations. So it's something that as we started, there was this notion that the high-risk hospitals are the level 4, level 5, up to level 6. But we have come to realize that actually we concentrated on the higher levels, while actually we were exposing the guys down there, and a bulk of the infections are actually coming from there.
Yes, naturally, because when someone exhibits symptoms, they don't go to the ICU ward, they literally come to that level at the clinic and get themselves tested. And we'll get into that issue of triage and that possible mingling of patients, and how this could be actually quite a danger, and what can be done to shift that and ensure we are all safe. But for now, let's take a short break. When we come back, we have more for you right here on health and much more on Morning Express.